Have you ever wondered how it is that the heart can contract in such a coordinated manner? This is due to the natural pacemaker and an efficient conduction system. On page 29 of your objectives, you can see a list of the elements of the conduction system.
Turn also to page 664 of your text to see how this system works.
Let's go through this tracing of the cardiac conduction system in the heart. On the Q drive, open up the document that says Conduction System of the Heart, and there you can follow along. Notice that the pacemaker of the heart is the SA node. That stands for sinoatrial node. Remember, this is anatomy, so you can't use abbreviations when you're discussing this on an exam. Then the impulse travels through the walls of the atria. That's because the walls of the atria are made up of muscle. And remember that muscle can conduct impulses just like neurons can. When this happens, the atria contract. They contract from the top down so that they squeeze the blood out of the atria through the valves, through the AV valves, and then into the ventricles. The impulse then reaches the AV node, called the atrioventricular node. Notice where that is. There's at least one model of the giant heart, and it shows you where these nodes are. Locate those on the models. After the AV node, there's a delay in the impulse there, just a slight delay, so that the atria have time to contract before the ventricles contract. After the delay, the impulse travels down the AV bundle, which is located in the interventricular septum of the heart. At the bottom, at the apex, there are branches, and these branches go into the left and the right side of the heart through the conduction myofibers. These are also called Purkinje fibers. Then notice that the impulse, as it reaches the apex, will branch into the muscle through the myocardium, and that causes the muscle of the ventricle to contract. This happens from the apex upward. Thus, the blood is squeezed out of the aortic and the pulmonary valves. So first the atria contract, and then the ventricles contract from the top down and then from the bottom up. This makes a very efficient system for emptying blood out of the heart. Please learn the parts of the conduction system and its pathways. Let's consider now the hepatic portal system. A portal vessel is usually considered a vein, but it is actually an unusual vessel because it has a capillary bed on both ends. It does not go directly to the heart without encountering a capillary bed. Its design is to allow for the processing of molecules by the liver before it enters the bloodstream. Blood coming from the intestines, stomach, or spleen enters the hepatic portal vein, goes to the capillary beds in the liver to be modified before it enters the venous system. This makes sense when you consider the load of nutrients that comes from the stomach and the intestines. It would be difficult to regulate levels of these molecules in the bloodstream if the liver were not involved first. The hepatic portal system makes this possible. You can see a diagram of this circulation
on page 697 of your textbook.
I want you to study that and know this circulation called the hepatic portal system. Circulation within the fetus is interesting also. This is because of three factors. Number one, the fetus doesn't need its lungs. Number two, the fetus doesn't need its liver. And number three, the fetus interacts with mom through the umbilical arteries and veins.
See page 713 for a diagram showing this.
There are two bypasses of the lungs in the fetus and one bypass of the liver, and there are three umbilical vessels. Can you figure out what these vessels are and what happens to them following birth? Please do that now. Read about it, study that, because we will ask you what are the 5 major changes that take place in the fetal circulation following birth. Check it out. While you're doing this, ask yourself the following questions about fetal circulation. First of all, what are 2 ways that the fetal circulation can bypass the lungs? See if you can figure that out. If you can't, ask an instructor. What are the 2 ways? that a fetus bypasses the lungs in the circulation? And then what is the one way that the fetus bypasses the liver in the fetal circulation? And what are the two vessels, or actually three vessels, that communicate with the placenta and thus with the mother's system? So ask yourself these questions and try to find the answer. If you can't, talk to me or talk to an instructor on duty.